We are proud to announce the release of guidelines to assist countries in the introduction of HIV Point-of-Care Diagnostics International Health Systems. Accompanying this document is a collection of tools assembled into a Point-of-Care Diagnostics Toolkit. This package targets key areas for the introduction and scale-up of point-of-care testing international programs. It focuses on point-of-care HIV testing, particularly early infant diagnosis, CD4 staging and monitoring, and viral load monitoring. It can be used by program managers, donors, policymakers, and implementing partners, as well as personnel involved in procurement and logistics, training and quality assurance. The guidance document is divided in two parts. Part 1 provides background information on HIV point-of-care testing and its potential contribution to meeting the 90-90-90 targets. Part 2 outlines the steps and key activities for introducing HIV point-of-care diagnostic testing international programs. Part 2 is divided into 7 major modules. One cross-cutting module named Monitoring, Evaluating and Improving Quality, and 6 distinct modules: Policy and Framework Development, Strategy and Planning, Regulations, Quality Assurance and Data Management, Procurement and Supply Chain Management, and Implementation. Each module consists of multiple sub-areas or components. For example, under Procurement and Supply Chain Management, there are 3 sub-areas: Procurement Methods, Forecasting and Supply Planning, Warehousing and Inventory Management. These 7 modules represent the key areas that should be considered when introducing HIV point-of-care technologies in any country context. The order in which activities are presented here is not meant to be prescriptive, and not all activities necessarily need to be implemented in all countries. These activities are suggestive, and countries should adapt and modify them according to their needs and context. Linked to the guidance document is a Point-of-Care Toolkit, which is a digital repository of tools and resources to support the introduction and scale-up of HIV point-of-care technologies. The toolkit can be accessed through the Children and AIDS website shown here, which is managed by UNICEF. At this stage, the Point-of-Care Toolkit contains 4 modules: Product and Site Selection, which contains tools to help countries select the most appropriate point-of-care technology and the facilities which will benefit the most from point-of-care testing. Forecasting and Supply Planning. It includes tools to help national programs forecast diagnostic commodities, as well as supply planning for point-of-care technologies. Regulations. It includes information about regulatory processes and frameworks for medical devices, product evaluations, national registration of manufacturers and products, and post-market surveillance. Quality assurance, which includes topics such as quality assurance of point-of-care testing, site certification and monitoring, and budgeting for quality assurance. The Point-of-Care Toolkit is available in English, and the associated guidance document is available in both English and French. They can be accessed through the Children and AIDS website, whose address is shown here.